Hello viewers, welcome to the Learners Nursing classes. Today is the topic appendix signs. So what are the signs of appendix? There are classical 4 signs of appendix which may come in exams or which may come in multiple choice questions. So the first is McBurney's sign. Now how to locate where is the McBurney's point? So it is from the anterior superior iliac spine, that bone, and from till the umbilicus, and there mark a line and then draw in between, and then 1/3 or from the umbilicus will be 2/3 from the umbilicus will be the McBurney's point, and if there is a pain, it is positive sign of appendix. Now coming to the next sign, that is the Blemberg sign. Now Blemberg sign is also is a sign when there is a pain. When you are pressing the abdomen, there will be a pain, and the pain increases when you release the pressure. So the tenderness will increase, the pain will be immensely increasing when you release the pressure when that has been applied. That is called as Blemberg sign. Now coming to the third sign is the Rovsik sign. Now Rovsik sign is a sign when there is a pain on the left side of the abdomen. When you put the pressure on the left side of the abdomen, there will be a pain on the right side where actually the location of appendix is. So this is called as Rovsik sign. In this N is silent, Rovsik. Coming to the third point is the Psoas sign. Now in Psoas sign, the psoas muscle will be inflamed. Now how? If the appendix is posteriorly behind the colon, then if it is inflamed, it will be causing the transmission of inflammation will be triggering the pain on the psoas muscle. So thus there will be inflammation of psoas muscle, there will be pain in the psoas muscle. So that is why this is called as Psoas sign. And if see in Psoas sign, the extension of hip and rotation it outwards will also give it pain. That is called as Psoas sign. The positive, it is positive. Now coming to Blemberg sign again, if the question comes to you that what is the rebound tenderness, rebound tenderness is the Blemberg sign, and because while releasing there is immense amount of pain. Thank you.